Dr. David Bushore, board-certified dermatologist based here in Austin, Texas at Balcones Dermatology and Aesthetics. Today I'm going to talk about the two most common forms of skin cancer. The most common one I see on a daily basis. I have some patients that'll have 4 at a time, 5 at a time. It's called the basal cell carcinoma. That's a B-A-S-A-L, not I-L. These cells are normal cells. The basal cells are based right along the bottom layer of the epidermis like this. They're right here, like this. But when they rapidly divide and turn into skin cancer, there's 2 main types. There can be superficial basal cell, and that means that these things are just hanging off the bottom of the epidermis like little grapes like this. So just being superficial, they're not super deep. And for that case, you have different options. You can even just kind of scratch it off. We can just numb it and scratch off that top of the skin. That's enough to get underneath that thing, and that's not super deep. The other type is called nodular, and that means that these things are making big tumors underneath the skin like this, all full of basal cells like this. That's a basal cell carcinoma, and that's deep. Those you can also scrape off if it's small, but your cure rate goes down the bigger that gets. And location also dictates if it's an important place like the face. We refer people for what's called Mohs surgery, named after Dr. Frederick Mohs. They locally numb it up, take as tiny a margin as possible. The goal of removing any cancer is taking 1 normal cell past the cancer if you can. Mohs is trying to accomplish that, just taking the tiniest margins to make sure this thing is gone. Basal cells, appearance-wise, can be hard to recognize. They can be almost skin-colored. When I'm doing my skin exams, I'll use my derm light to almost shine sideways so I can see if there's like a little bump. They can be clear. People get them confused for acne bumps or like a scar that's just starting to grow, but all cancers are growing too fast. So if you notice it's starting to grow, look for that, and it can be just a clear looking bump. Squamous cell carcinomas, on the other hand, those are a cancer of the cells that are up in here. And you can also have a squamous cell carcinoma in situ, which means it never left the epidermis. So this is just staying up in here. The most common thing that people get treated in our office are what are called actinic, keratosis. And these are the rough spots that you feel on your face. You've probably had those treated with liquid nitrogen. These mean that you have atypical cells just along the bottom layer of the epidermis here. And we can fix those before they can turn into squamous cell carcinoma in situ. So in situ means it never left the epidermis. So these atypical cells from an actinic keratosis will fill up the epidermis, and that becomes a squamous cell carcinoma in situ. Squamous cell carcinoma can also be nodular, so that can also go deep, just like our basal cell, and get deep down in here and make a deep invading squamous cell carcinoma. And those are a bigger deal. Those do need to be excised. So basal cell, squamous cell are most common types of skin cancers, and this is how we treat them.